demonstration for assessing the skin. So without other further ado, okay, for the step 1 is gather supplies. Sure, you have a good lighting and any necessary tools like a floodlight for inspecting dark areas. For the rationale of this, step 1, it is to gather equipment beforehand will promote organization in the area. So for the step 2, do the proper hand hygiene. So for the rationale, you need to do the hand hygiene because hand hygiene prevents the spread of microorganisms. Patient education. So briefly explain the patient the procedure and ask for their consent. So ang rationale ani kay kuan kaning mag-ask sa patient and explain nato sila ang procedure para sad aware atong patient. And then proper gyud ani kay you ask or we should ask consent sa ila before doing the examination. So for the fourth step is observe the patient's skin color for uniformity, not noting any areas of pallor, redness, and cyanosis. For the rationale of this, to identify sign of jaundice, pallor, cyanosis, and even skin cancer, and to identify any skin pigmentation disorder. So the next step is assess skin texture. Okay, for the rationale of this, check patient's skin. Ang texture niya kung smooth ba siya, dry, or naabay bones or rashes. Okay, for step 6, look for sign of edema or swelling by applying gentle pressure to a different areas. Okay, for the rationale of this, edema may cause skin stretching to a point of pruritus and discomfort. Okay, for step 7, use the palmar surface of the hands to gently palpate the skin. So, gamitin atong palmar surface atong hand to assess or to palpate a patient's skin. Dayon, ang rationale ani kay some skin kuan manggod lesions may lead to skin cancer. So yeah, pero skin moisture can be a good indicator for a patient's health condition. Okay, for the step 8, pinch a fold of the skin of the patient's forearm and abdomen to assess how quickly it snaps back like skin turgor. Slow return indicates dehydration. So, for example, sa patient kaya na-pinch na ito siya din, ibalik rin siya, normal lang siya, so very normal lang. Pero pag hindi ito siya magbalik into same positions niya, muna siya sa dehydration. Okay, for the rationale of this, to assess skin elasticity manggol and detect any sign of dehydrations and edema. For step 9, pay particularly attention to areas prone to pressure ulcer, such as the sacrum, heels, and elbows. Okay, ang mga areas na prone sa pressure ulcer manggol kaya like mga bony parts like hips, your heels, shoulder, bladder, then atong elbow, and then siya mga prone sa pressure ulcer. Okay, for step 10, inspect the scalp for lesion, hair distribution, and hygiene. Okay, check, ang rationale is check na si patient yung scalp and hair kung good hygiene ba siya or dili. Okay? Okay, for the step 11, examine for the face, color, and any rashes of the lesion. So, atong i-examine si patient yung mamong kung namin mga lesion or any rashes na nakita. Okay, for the step 12, 1, 2, okay, document your findings in the patient's chart, including the observed skin color, texture, temperature, and moisture. Presence of edema, lesions, wound, or rashes. making vigor, etc. etc. Okay. Ang rationally ani kay general finding of the assessment done should always be documented in health chart record para punatay record or to keep